Hi everyone, my name is Claudia Lugo Candelas, and today I'm going to be walking you through our paper called ADHD and Risk for Subsequent Adverse Childhood Experiences, Understanding the Cycle of Adversity. So adverse childhood experiences are very common and they encompass three main categories: parental loss, maltreatment, and parental maladjustment. ACEs, like I said, are very common, although they are more commonly experienced by children, individuals from disadvantaged populations. So, for example, ethnic and racial minorities. The detrimental long-term impacts of ACEs are well documented on both physical and mental health well-being. However, particularly important for the study at hand is the consistent finding that children who experience ACEs are at an increased risk for experiencing ADHD later on in life. However, the reverse association, whether having ADHD increases your risk for experiencing subsequent childhood adversities, is not well understood. And a couple of studies had hinted at this association. However, they've been limited in that a lot of these studies are cross-sectional. And what happens with the cross-sectional study is that if you have concurrent ADHD and ACEs assessments, you have this bit of a chicken and egg kind of situation when you don't know which one came first. The literature has also been limited in that it hasn't included the children at highest likelihood for experiencing adversity. So again, like I said, socioeconomically disadvantaged children and children from ethnic and racial minorities are at increased risk for ACEs and ADHD as well. This is particularly true for Latinx populations in the US. They have higher ACEs than their counterparts, and ADHD diagnoses have skyrocketed within these populations in the last decades. So the present study aims to address the gaps in the literature and inform our prevention strategies by examining if children with ADHD are at an increased risk for ACEs in a prospective longitudinal population-based study of Puerto Rican children and adolescents in the South Bronx, New York, and in Puerto Rico. Here, we're going to leverage a prospectively collected ADHD and ACE assessments. And by doing that, we're uniquely able to examine whether ADHD at this one initial time point predicts the subsequent experiences of ACEs while adjusting for pre-existing, what we're going to call baseline ACEs in this underprivileged population are at high risk for ACEs. The participants in the study are the Boricua Youth Study, BYS participants. This is a study of two representative longitudinal probability samples of Puerto Rican children and their parents. Families were included in the present study if they participated across all three data collection waves. This yielded a sample of 2,134 children that were ages 5 to 15 at that first assessment wave. So participants were interviewed in their home and followed for 3 waves of data collection, each were 1 year apart. The BYS has achieved excellent retention rates. So by wave 2, that was 92%. By wave 3, it was 88%. ADHD was assessed at all 3 waves via the diagnostic interview schedule for children, so the DISC, and ACEs were assessed using a number of instruments. We have reported those separately, and I will refer you to the paper with a citation to the original paper that details each of the assessments. But briefly, we assessed 11 adversities covering 4 domains, so childhood mistreatment, which included neglect and physical, sexual, and emotional abuse; parental maladjustment, which included intimate partner violence, antisocial personality, and parental arrest or jail; substance use problems and emotional problems; and then exposure to violence; and lastly, parental loss, which included parental death and divorce/separation. Unfortunately, we were not able to address here a very important ACE, which is experiences of racism and discrimination, and that has to do with the fact that some of our children were quite young and at original data collection waves, so we didn't ask that from them. Our analysis to examine whether wave 1 ADHD increased risk for subsequent ACEs, we used logistic regression using survey procedures in SAS. Our outcome measure was having a new and that means a not previously experienced ACE at either waves 2 or 3. So you could not have had experience at ACE at wave 1 for that one to count as a new incidence ACE. Adjusted models controlled for site of recruitment, age, disruptive behavior disorders, use of public assistance, wave 1 ACEs, and child sex. So our analysis showed that wave 1 ADHD was in fact associated with increased odds of experiencing a new ACE at waves 2 or 3. When risk for ACEs was examined separately for each ACE domain, we found that parental maladjustment at wave 2 or 3 was significantly predicted by wave 1 ADHD. We also examined ADHD subtype effects, and we found that the inattentive but not the hyperactive or the combined presentation subtypes at wave 1 were predictive of wave 2 and wave 3 ACEs. So findings document that ADHD predicts increased likelihood of accruing subsequent ACEs, and that inattentive ADHD may be the strongest predictor of future ACEs. Here, because of our longitudinal assessments, we're able to establish a clear temporal sequence that strongly indicates that the ACEs that we considered as outcome in our analyses occurred after the ADHD symptoms were present. Given the well-documented associations between ACEs and subsequent risk for ADHD, this study really points to the cycle that perpetuates hardship and adversity in the most underserved of populations. We think that the finding about inattentive ADHD is likely to be about the nature of the very symptoms. So inattentive symptoms are less likely to be detected. Treatment for these starts later and it lasts, it's a shorter duration. And these symptoms also frequently persist into adulthood. So the longer these symptoms hang out and are present, that might give more opportunity for these snowballing kind of effects. Our findings suggest that ADHD may have a role in perpetuating the cycle of adversity and highlight the dire need for treatment. Because ADHD treatment is usually followed by symptom reductions, ADHD treatment may be a viable ACE prevention strategy. However, our findings strongly underscore the need for parent-centered interventions, maybe in the form of mental health or substance abuse services or parenting support. The major finding of the major point that our findings highlight is that we echo the growing number of studies that suggest that ACEs are a serious public health concern and that we need public prevention efforts. Thank you so much for your attention.